My name is Vračar, and I'm the People's Health Movement Regional Coordinator for Europe. In PHM, we believe in health for all. We believe that health for all can be achieved if we come together, if we stand together, if together we fight against the interest of the powerful in the world today.
In this episode of Charter4Health, we talk about the struggle for the right to health in Europe, gender justice in health, freedom of the press, and the challenges of communication for health. Welcome to Charter4Health, a PHM podcast series on the right to health. Hear the voices and insights of health rights defenders at the forefront of the struggle for health for all from around the world. I am your host, Miguel Garcia, and this is Charter4Health, a podcast series from PHM Global. Follow and share from wherever you are on iVoox, or go to our website, phmovement.org. We are the People's Health Movement. Join us in the struggle for health for all. Our guest today is one of Charter4Health Podcast Producers, Anna Vračar. She's a cultural anthropologist focused on critical and medical anthropology, master in public health. She has been an advisor to trade unions like the Organization for Workers Initiative in her country, Croatia. She's also a health journalist based in Zagreb, reporter for the People's Dispatch, and chief editor of the People's Health Dispatch, and the regional coordinator of the People's Health Movement in Europe. Welcome, Anna. It's a pleasure to have you here.
Hi, Miguel. It's great to be here.
Being Colombian myself and having grown up in a country in permanent state of conflict, and as a journalist having to cover the Colombian internal conflict, we are still facing huge challenges in peace building. I would like to start by asking you, what has it been like for you to be born in the midst of the outbreak of war, to grow up in such a hostile environment, and to live through the post-conflict period in your country?
Well, I think it's fair to say that, here it depended really on where you were. I was lucky enough to be far away from like the center of it. So I didn't experience much until much later on. And then, when you start looking at how the transition goes and what it's bringing, it actually brings this different kind of violence along. So I think that's one of the most striking things for me, remains until today. So, if you look at how healthcare has changed since, and how, in fact, the content of healthcare continues to change in comparison to what we had before, and then compare it to what you get when you talk about it, and when people talk about how health must be much better today because it's not centrally dictated, or it's not, it's supposed to be more democratic, it's supposed to be more people-oriented. And then based on experience, you see that it's actually not like that. So what we had before was actually much more democratic and much more people-centered than with what we have today. I think that's something that, for me at least, it corresponds a lot to that experience.
How did you become interested in social sciences, and especially in the field of public health?
So essentially, my mom, she's a midwife. She has worked as a nurse and a midwife for her whole life. So basically, I was observing her as she worked until I moved away for my studies. And at the time, I actually didn't reflect much upon it. It was a job, so it was. It must be said, it wasn't a great paid job, but it was a job. It was a job which was respected at the time. So, it was a job which was concrete, which I could explain to myself, to the people I talked about. And then when I got a bit older, I started to think about also essentially what it was like for her, because it was very different. So I know that she and her colleagues, they had a lot of problems in their workplaces, also because of the transition to privatization that we were observing. And so that's something that, you might not be faced with if you're a patient without a different connection to the health system. And you might notice it if someone close to you is so involved with the health system. And so as time passed by, I continued to work on that and continue to reflect on that. And I just stayed in that field. So that's it.
So the discussions on the right to health are diverse and very complex. And at the same time, the struggle for the right to health is the same, no matter where you live. I would like to hear your perspective on the struggle for the right to health in Europe.
Okay, so it's a big one. because always when we talk about Europe, one feels the urge to trash the place because it's, it has to be recognized that the effect that Europe has played on access to health, as access to all other social services in the world, is huge. So it's been extremely dangerous and harmful to the global south, to other places. But then also, if I reflect on the last like 5-6 years, while I was a bit more involved in PHM and working with health movements in Europe, it's actually great to see how critical people also are about the role of Europe, but at the same time recognize that the right to health is something that we have to struggle here as well. So there's enormous diversity, I would say, among the health movements in Europe, among, when we talk about the things that they choose to focus on, when we talk about the priorities that come out from the local health systems. Because of course, it's not realistic to say that there are not any similarities between the health systems in Europe. But there are some things that, can really drive a movement in one way or another. So it's been great to actually see and then to interact with people who, I don't know, they've been working on access to health, to access to medicines in Europe for a very long time. And then to see how the approach to this changes between Eastern Europe and Western Europe, and how the different responses to the problems actually arise and form. So, for example, it's maybe not about access to medicines, but if, for example, we talk about the migration of health workers, and particularly care workers, nurses, and groups like this, at some point a couple of years ago, we had a moment where everybody was talking about how horrible it is, that there's actually this big migration and it's uncontrollable. And of course, it's draining health systems, and we're all missing health workers. And then at some point you get in a conversation with someone from West Europe and said, okay, and you complain about this, being a person from Eastern Europe, saying, well, it's really not cool, guys, all of these people have left and now they've come to work, I don't know, to Germany, to the UK, to France. They didn't get good jobs. They got bad jobs. They got poorly paid jobs with no security, with no access to trade unionization. So it's not a great situation. And then years ago, the response was, yeah, but we understand it's kind of bad from where you stand, but if they don't come, nobody will care for the older people that we have here. It's been amazing seeing that discourse change. And I can very happily say that it's not a response that I get very often anymore. So now it's, I think it's the effort that has been put in building a movement for health in Europe and across Europe has actually led us to a point where we can say, yes, we have a major problem and we'll only resolve it if we figure out something together, not if we, clash or drain each other's pools of health workers or factories or whatever.
In that same sense, what are the problems in terms of quality jobs for health workers and wages and the differences that there is in this? And because we have seen health workers facing issues and demonstrating in different parts of Europe, in England and in France. And what's the situation there? Because we see a lot of differences in the quality of work and wages and the workloads that these doctors have and these medical workers have. At the same time that there's a huge privatization across the different health systems. What can you tell us about that?
Well, actually, as PHM Europe, we did a conference very recently together with Viva Salud and with the Association of Democratic Doctors from Germany. And I really liked how one of the co-organizers from Viva Salud, Matilda, she framed it, and she said that Europe does not have a crisis of health workers. It's facing a crisis of good jobs. So what you describe is essentially the reality wherever you look. It's, I would say, more about gradation. So if you're standing in Serbia and if you look at the at the working conditions in Germany, they will seem much, much better. So yes, they will give you, a better chance of making a living and leading a good life. But then again, you have to ask yourself then, why would Germany have such a deficit of health workers if everything was going so splendidly? So essentially, the workers who are trained there, who spend their lives preparing themselves to work as a doctor, to work as a nurse, they don't meet they don't find the conditions that would allow them to have a dignified life there. So I think it's about how we frame the health system and how we talk about jobs in the health system. And for a very long time, it has been about, everybody telling nurses and technicians and lab workers, physiotherapists, whoever you want, oh, well, yours, it's not really a job, it's a vocation. So you should be happy. You're doing something that you're really passionate about. You're doing something that you really love. So pay and working hours and all of that, it's secondary, right? It doesn't matter that much. Well, I think it matters a lot because there's been like a lot of stress put on these people through COVID, of course, but also before. And I think that the wave that we have seen over the past couple of years, specifically since COVID, comes from that place. So they have been telling for years and years, guys, this austerity thing, it's killing us. The savings, the cuts, they're killing us. We cannot make it anymore. We're too tired. We're stressed out. We're burned out. We're leaving. A lot of people left. So, one of the big problems that health systems in Europe currently face is actually retaining the health workers that they manage to recruit. It's not only about them not being enough in numbers. It's essentially not giving them the opportunity to actually work without feeling that they'll die in 2 years if they continue on the same pace. And yes, privatization plays like a big role in this, because we know that from pre-COVID research that privatization comes with worse working conditions. If we want to raise the example of unionization again, if you're in a private health institution, you're less likely to be unionized than compared to the public sector. The trade union, it gives you protection. We've seen it through the pandemic that it gives very concrete protection. Workers who are not unionized, they had a more difficult time to press for proper protective equipment. They had problems with ensuring that everything in the workplace was set in a way to protect them and the patients at the same time. And so it has a lot to do with this. It has a lot to do with this never-ending need and wish of the private sector to just expand and eat everything it can eat, just for the sakes of profit, and then leave to the public sector whatever remains. And that's usually the poor people and those services that are not profitable. So who would like, I don't know, to privatize something as well, actually, they've done a very good job at privatizing everything, but essentially some services are sexier than others, if we can put it that way.
Yeah, and at the same time, there's a brain drain occurring in other parts of the world, like there's a lot of health workers coming out of the Philippines, as we heard, de La Paz, and from India and from Africa, that are coming to especially the different health systems in Europe, and that's also having a huge impact on jobs, not in the other parts of the world where these health workers come, but also in the health systems in Europe.
Yeah, it does. But I think it also does because it's the position that the workers are put in once they're here. So to begin with, all this story in Europe, it's framed in a way that it's a win for everybody. If nurses are recruited in Brazil, it's because there are too many nurses in Brazil. So we're doing them a favor. They're going to get a good job. They're going to get higher salaries that they would get at home. They will send remittances at home. So everybody profits, no? And of course, we don't mention that in public, but the fact is that the recruiting country in Europe is going to recruit hundreds of nurses for a fraction of the cost that it would take them to train them at home. But nobody says anything about how the process that the workers are actually brought with, if it's through recruiting agencies, Where do they sleep? Where do they eat? How do they learn the language? Do they help them actually get the accreditation that they need to work in this new health system? And unfortunately, as we have seen from experiences of global trade unions, it's the very opposite of that. So most of the workers who come, they come to a very bad place. They have no protection. They have close to zero information about the rights that they should have. And then, yes, so they're asked to do things that mostly local workers would not be asked to do, because, there's more room for exploitment like that.
And they still need to send money back home to their family. So it's a really cycle of trouble there.
Yeah, of course. And I mean, one other thing is that that is rarely acknowledged is that, it's not, again, coming back to Brazil, it's not like Brazil does not have too many nurses, as far as I've been told. So from comrades in Brazil has too little space in the budget to employ enough nurses to actually meet the actual demands. And this is not just Brazil's experience, it's also an experience of many countries in the global south. And that's because Europe has actually strangled them with debt. So it's a very, I'm tempted to say it's a complicated situation. It's not really a complicated situation. It's a situation that we have known about for a very long time. But I think now it's also a bit about how we choose to take it from here. What do we do with this? So can we actually force through our movements, the governments and the health ministry to acknowledge that it's stealing someone else's health workers after strangling them with financial measures from before? And if we get them to admit that, what do we do then? So it's also going to be a very long process of breaking up this vicious circle of depending on someone else's resources.
Let's take a short break. You're listening to Charter4Health, a PHM podcast. Stay with us.
We are the People's
Health Movement.
PHM brings together health rights activists and organizations from around the world.
For over 2 decades, PHM health defenders have been at the forefront of the struggle for health for all.
We maintain an independent voice without fear or favor.
But now we need you to stand with us.
We need your support to continue our critical and independent intervention on all health matters.
To contribute to our cause, go to our website, phmovement.org, and find out how.
Contribute
and say
proudly
that you support
health
for all.
Health for all.
Health for all.
Health for all.
Health for all.
Follow the discussions on health issues at the World Health Organization on the WHO Tracker website. Through the WHO Tracker, PHM closely follows the work of the World Health Organization and prepares commentaries on agenda items at the WHO governing body meetings. These include background and critical health perspective analysis with recommendations for policymakers and civil society. Visit the WHO Tracker on the People's Health Movement website at phmovement.org. Join us in the struggle for health for all.
What is your take on the role of women in the struggle for health, peace, and gender justice, especially in the context of the war?
Oh, wow. Okay. So, yeah, I can speak very marginally about this, but from my personal experience, I think the first thing that comes to mind and jumps to the forefront is that women actually make the majority of this movement. So, yeah, if we talk about the health movement, I think for me, locally, it's been shaped by women. We do have some men comrades come in every now and then, great experts. But essentially, the work, most of the work is actually done by women, and so it also shapes kind of the this kind of also shapes the content of the movement that we have in front of ourselves. Of course, as we also maybe manage to take a more active role, a more active driving role in the movement, it also means that the priorities of the movement has to change, that it has to take into account that for a very long time, the position of women has been pushed aside and maybe not addressed in the way that it should be. So I think, again, it's something that will take still a lot of time to actually address, to see how we manage to raise the profile and the discourse on topics that have been left behind for a long time. I think that, if we look at the more recent struggles when it comes to reproductive health, when it comes to abortion, that's a good indicator where we can go and what kind of mobilization we can achieve if we choose to actually give women the space that they need to address some of the problems. And I think there's a million of topics that have been left behind because they're perceived as like quote unquote women's problems, so less important than the ones that we should be pursuing. And it's not only about physical health; it also has a lot to do with mental health and stuff like that. So it's I think the role of women actually defines where the movement goes. It also shapes a lot of what the movement chooses to speak about, and that's crucial, I think, because my opinion is if we pursue the path where we have been for now, then give women a more active role, then we talk more about care, and then the whole thing that we have been advocating for in PHM, for the world to become a more caring world, it actually becomes a bit more feasible if we're actually practicing care too.
Yeah, and again, to talk about reproductive rights, we see, for example, an anti-gay law in Uganda, and the struggle for safe abortion and the struggle for equity worldwide in terms of gender justice. Our societies seem to take one step forward and two steps behind. In looking at that context in different parts of the world, especially in the global south, what do you see in terms of sexual and reproductive rights, and especially in gender justice?
Okay. So not being from the global south, it's a bit tricky to give a fair account. But from my point of view, I think that I've seen tremendously powerful movements coming for women's rights from the global south recently. Starting from the whole wave of mobilization for safe and accessible abortion in Latin America, and I think we have seen very concrete outputs to that struggle. We have seen laws changed, but we have also seen more and more people pouring into the movements, and I think that's one of the things that we usually tend to maybe not talk enough about, is that the strength of our movement, of course, depends on the numbers that we have, and by introducing more people, it's also technically a more powerful movement. So 1 million women on the street marching for safe abortion is something, even if some guy then decides not to enact the law, it's still a powerful movement. It can do things. So I think that's one of the examples. But more recently, even I would say that the mobilizations that we have seen in India against femicide and against unsafe conditions that women are exposed to in their workplaces, which has actually been spurred by a femicide of a junior doctor in India, by the way. So I think those are all mobilizations that kind of tend to grow, and particularly recently, it's been easier to hear about these struggles. Maybe, hopefully, it also helps to see that it's not something that's isolated. It's something that's popping up in different places at the same time, and that at one point, if we manage and if we work really hard to bring all of these things together, then maybe a real breakthrough will happen at some point soon. Well, soon, hopefully soon.
Hey everyone, I'm Chiara Bodini, co-editor of the Global Health Watch 6, flagship publication of the People's Health Movement. I am also a producer of the GHW podcast. Listen to the first season of our podcast in English, Spanish, French, and Arabic on iVox. You can also go to our website phmovement.org/GHW-podcast.
Are you tired, puzzled, and unsatisfied by how the corporate media covers health? Read, share, and subscribe to the People's Health Dispatch, a fortnightly bulletin published by the People's Dispatch and People's Health Movement, focusing on the politics of health and the struggle for the right to health, especially in the Global South. I am Anna Vračar, editor at the People's Health Dispatch. Remember, click, read, share, and subscribe.
I would like to take sort of like a left turn in our conversation and ask you how journalism for health became a field of interest for you.
Okay. So it's I think it's been if we're talking about People's Health Dispatch, so we're talking about the beginnings of the COVID-19 pandemic, especially. So at that time, we were talking about also inside PHM that, how important it is to actually produce materials which talk about health struggles, that talk about health workers, that are accessible to everyone, because that's still something that I think we do struggle inside the health movement, to actually produce materials that are understandable to anyone outside the movement. And People's Health Dispatch has essentially been an attempt to do that. So we ask the people who are taking part in the struggle either to talk to us or to actually write it themselves, or to record it themselves. And that's something that I think it's a key component of the health movement, to give the voice to the people who are actually doing it. Because if we end up in like this endless translating of someone tells me and then I tell someone, and then that someone goes to a conference and takes 3 minutes to speak about a particular struggle, that's nice, but it kind of doesn't have the same effect. So that's how it happened.
From your point of view, with the current media environment and the tremendous speed in which the news cycles develop, and the situation of the freedom of the press, what are the challenges of communication and coverage for health issues?
Oh, wow. Okay. A lot of issues. So I think there's not a scarcity of topics to cover. I think that's the plus side. One of the things that for me personally have been good inside People's Dispatch and People's Health Dispatch is that essentially we can claim a bit more time to look into the topics that follows out the news cycle. So it's not like, it's important, yes, to react to the news as they happen. Of course, you want to bring the news that polio has been detected in Gaza after more than 25 years because of the genocidal violence that we have seen since October last year. But on the same time, you want to have more time to actually learn about what that means. What does it mean that polio is re-emerging in Gaza? What would it mean 20 years from now if Israel kills all the workers who are trying to vaccinate the children through the WHO right now? What does it mean? How will it impact the health system there? So I think it's important to have this kind of liberty to elaborate a bit more on the important topics. And then, of course, I think it's also very important to be able to draw upon, and luckily PHM has that, to draw upon a group of quite critical experts who can speak legitimately about topics that would usually be considered like too technical or too important to be left to some kind of crowd of crazy activists who don't actually know what they're talking about. And I think that's an important one to break. So we have been able through PhD to actually let people articulate a different point of view. I think some of our more recent examples of that are the work that has been done on public pharma, because it's a bit more radical than what we would have read before. It also, it builds upon the practical experience of our circles around the world, around what they're trying to build from the bottom up. But it's also very important because it speaks about a topic that has been big, and it has been big, for decades now. And it brought already at the very beginning of the newsletter, but I think even in the later phases of it, a different view to how this model can look, and also to bring in some of the more concrete examples that we have seen of it in the world. So it's not really true that big pharma is the only alternative that we have. We have seen, and we will see, different attempts to build a different pharma system that is more approachable to the people, and it's actually responsible towards the needs of the people.
Thank you so much for taking your time, and had a great time talking to you. Thank you for being here.
Thanks for this, Miguel.
We are the People's Health Movement, bringing together health rights activists from around the world. Join us in the struggle for health for all. This episode of Charter4Health was produced by Ainelinde Coquelar and David Verstock. Editing by Luisa Fernanda Viatella. Technical support by James Von Duren and Edwin team. Special thanks to the People's Health Movement, grassroots organizations, affiliated networks, PHM members, health rights defenders all across the globe. To our guests, producers, writers, editors, technical support, and all of those people who made this podcast possible. My name is Miguel Garcia, and this is Charter4Health, a PHM podcast. You can find much more about PHM and its call to action by logging into our website, phmovement.org. This is a People's Health Movement production.
We
are the People's Health Movement.
PHM brings together health rights activists and organizations from around the world.
For over 2 decades, PHM health defenders have been at the forefront of the struggle for health for all.
We maintain an independent voice without fear or favor.
But now we need you to stand with us.
We need your support to continue our critical and independent intervention on all health matters.
To contribute to our cause, go to our website, phmovement.org, and find out how.
Contribute
and say
proudly
that you support
health
for all.
Health for all.
Health for all.
Health for all.
Health for all.
Follow the discussions on health issues at the World Health Organization on the WHO Tracker website. Through the WHO Tracker, PHM closely follows the work of the World Health Organization and prepares commentaries on agenda items at the WHO governing body meetings. These include background and critical health perspective analysis with recommendations for policymakers and civil society. Visit the WHO Tracker on the People's Health Movement website at phmovement.org. Join us in the struggle for health for all.
Hey everyone, I'm Chiara Bodini, co-editor of the Global Health Watch 6, flagship publication of the People's Health Movement. I am also a producer of the GHW podcast. Listen to the first season of our podcast in English, Spanish, French, and Arabic on iVox. You can also go to our website phmovement.org/GHW-podcast.
Are you tired, puzzled, and unsatisfied by how the corporate media covers health? Read, share, and subscribe to the People's Health Dispatch, a fortnightly bulletin published by the People's Dispatch and People's Health Movement, focusing on the politics of health and the struggle for the right to health, especially in the Global South. I am Ana Vračar, editor at the People's Health Dispatch. Remember, click, read, share, and subscribe. I think that speaking generally about PHM, for me, it's been quite interesting. It's been amazing, actually, to see how a movement of this kind can work, because it's been the first time where I have experienced that people come together and it all kind of clicks. So it's quite clear when you're in the company of people from PHM. It's clear what you are doing, what you are working towards. It's mostly, I think that on several occasions I have spoken to PHM people who have described this as magic, and I think it kind of fits the description, because it's really a completely different feeling working with PHM than with anything else that I've had the experience to work with before. And of course, I think that there's also this element of learning from people, but not so much from like a transfer of knowledge. I think for me, it has worked much more of knowing people who have been with PHM from the beginning. And then just, it comes from working with them to see how they approach things, how they see things, how all these things that maybe for someone who gets in PHM now, and it seems very new, that this has already been talked about before, and there's a lot of stuff happening in the background which you want to know just to be more informed and to work better.